My name's Stephen Hill. I'm Chief Exec here at Coventry, Warwickshire and Worcestershire Mind, but I'm involved in the Prevention Concordat as one of the founding members, and also I co-chair the meetings that we have. So the Prevention Concordat is an agreement. It's a formal agreement, and that generally is between a number of organisations, and it was signed off by the integrated care system as a formal agreement about how we were going to address the mental health and wellbeing needs of the communities that we're here to serve, with the main focus being around concentrating on the prevention agenda. So preventing people from getting unwell. If we can do that, then obviously it helps people around their mental health and wellbeing. So one of the things that's, obviously really important is good mental health for all. And good mental health means that we can be more active in our daily lives. It doesn't stop us from being involved in the communities that we live in. It doesn't stop us from being involved in employment So we want to try and support our communities across Coventry and Warwickshire to be healthier. The way to do that is to work towards that prevention agenda. Mental health has a massive impact on the society we're here to serve. We know that it costs the country a lot of money to support people, both when they're unwell, but also to provide the services then to help them when they are unwell. So it's not just, keeping people in work or keeping people physically active and able to engage in their communities. It's also the fact that, there is a massive cost to supporting those people that are feeling unwell. We know that 1 in 4 people at some point during the year will experience a poor mental health episode. For us, it's a win-win situation that if you sign up to the Prevention Concordat, then not only, do you become part of a group of organisations that are driving this agenda, but you're also ultimately supporting people to stay well and be able to function better. So originally, the group that came together was led by Public Health. So both Coventry and Warwickshire Public Health. More latterly, they brought together a group of organisations. Our organisation, Concordat, Warwickshire and Worcestershire Mind, was one of those organisations, alongside the NHS and alongside other local authority partners. And we've also brought some of the other VCSF SE organisations into that discussion. So it's really a collective voice from across the whole system. This cannot be done. Prevention cannot be addressed without it being a system-wide approach. And for that reason, that's why the overarching signatory of it is the integrated care system, who have taken that ownership of saying, yes, we support this approach to the prevention agenda. So I think we've achieved an awful lot as a group over the last couple of years. Obviously, initially we came together and the sole purpose was to get us all signed up to this agreement. We got through that process in the latter end of 2023. As we went into 2024 then, we started to bring ourselves together and we set up the delivery group. The delivery group was, for us, it's a key milestone in terms of those organisations coming together and really being able to plan how we take this programme forward. I think the other thing was, that delivery group needed accountability. So in order to have accountability, it is aligned to the Mental Health Collaborative. It reports its actions in through that collaborative group. So we know that we have somewhere to take that information and so that can be elevated and escalated within the system. I think the other thing for us is, that we are part of the West Midlands Mental Health Commission area. They'd already set out some key milestones that they wanted to achieve, and they aligned very closely to the work of the Prevention Concordat. So we've been able to align ourselves to that. I think the other key success is, something around having a presence and a visibility out there. So we have a website. We have the information that is out there now in the public domain, so people can find us and they can find out what the Prevention Concordat is about. We also have recently produced an annual report for our first year, and I would encourage you to go and have a look at that annual report, because I think it's a really valuable way of finding out more about the work of the Prevention Concordat. I'm really excited because I think the next 12 months is an opportunity for us to embed what we've been doing over the last 12 months, but really move forward, particularly around the health inequalities agenda. I think there is much more that we can do around that prevention messaging, around health inequalities, and, delivering more bespoke services, particularly within our diverse communities, around education and awareness raising around mental health. There's also some stuff around physical health, aligning physical health and physical activity around mental well-being. So, encouraging more activity-based sort of prevention messaging. There's also the Stop Smoking agenda, and for people with severe mental illness, that's about reducing or stopping smoking. If we can get people to reduce, then they may then get to stop. It's having that built into the system so that we can work with people to hopefully make them physically healthier. There's also something around the housing agenda. Housing is really important for people around, their mental well-being, as are many areas of daily living. And we want to work with our housing providers to make sure we have good quality housing for people that can hopefully, enable them to stay safe and, help them to really be part of the communities they live in. So I think it's an exciting 12 months for us. We'll just keep the momentum going for the Prevention Concordat.